My name is Lara Hayes, and I found KCPP sort of serendipitously because a friend of mine gave me a magazine that had all the best doctors and all the different specialties for Kansas City, because they knew that I was looking for actually a sleep doctor. And so in thumbing through it, I came across Dr. Handoo's information. I was also looking for ketamine treatment. So I found him there, and then I was actually inpatient somewhere. And they gave me his information almost simultaneously. So I got it from two different sources. Well, I struggle with a major depressive disorder. I had my first breakdown at 19, back when Prozac was brand new. It was still very embarrassing to have mental illness. So I was diagnosed and really struggled for the last, so what does that make? I'm 56 now. So I've been struggling with it for, what is that? Almost 40 years, I guess. Bounced between diagnoses, they weren't really sure, and it was really frustrating. And I've also really struggled with medication-resistant depression. So I've tried literally every drug out there, and just nothing worked. It was very frustrating. Because I'm of the age where psychedelics were a thing, right? People in college did a lot of LSD, and I was always scared of that because, you hear the horror stories and so yeah, I guess I was a little afraid, but I had gotten to the point where I literally had no other option. And so I decided, especially after reading the article, everything was so positive about Dr. Handoo and his practice that I thought, this is what I need to try. I knew that I struggled with suicidal ideation, and I have for, again, 50 years. But I don't think I realized how much real estate it took up in my head. I did not realize that I thought about it constantly. And right before I went in-house in January, we went to Aruba, and I told Will, my husband, if I don't come back feeling better, clearly something needs to change. So I didn't feel better. We had a beautiful vacation, great time, and I still wanted to kill myself. So I went inpatient. We talked about the fact that I've gone through all the medications, and I realized that I needed to try ketamine. So I will say literally after the first treatment, I noticed that my symptoms had improved. And I think at the time I had a score of 26 before the treatment, which is very high. And the very next treatment, which is a week later, I was at I think a 7 or an 8. It was very low. It was literally immediate. So the treatments themselves are interesting. They're very quick. You're in, and they do an IV, they hook you up with the IV. And Dr. Handoo and Elizabeth are really good about making sure your comfort level is addressed in terms of, it can cause some nausea, so he prescribes Zofran for that, and he adjusted that as needed. And they just make sure that there's some other, that you're comfortable throughout. Very comfortable chair, very relaxing. And they put the IV in, and it's very quick. I think it's 40 minutes. I imagine for everybody it's a little different. You're very much in your head. You kind of lose track of your body, which is interesting. And it's just your brain sort of doing its own thing. And it's, they give you a playlist that kind of keeps you on track in terms of pleasant music and kind of making sure you're calm. I don't personally get a lot of, people talk about, they see bright colors and stuff. For me, it's mostly just patterns. I just like shifting patterns. It's actually kind of interesting. Dr. Handoo is very positive, which is helpful. I mean, he really believes in this. You feel like he really believes it's going to be helpful for you. And I think that helps going into it, to know that he really believes it's going to help. There's a screening process, and I think it was fairly long. We talked on the phone, I'm gonna guess at least an hour, maybe longer, where he really went over my history, because he wants to make sure you're a good candidate for it. And so he walked through my history and just was really positive, made me feel very hopeful for the first time in a very long time about he has some treatment that might actually work for me. And he's like, I think you're gonna be a great candidate. And Elizabeth, I love her. She's just really gentle and kind, and she's a very calming presence, so they make a good team. My experience with KCPP has been life-changing. I mean, there really is no other. I would maybe even go so far as I have used the word miraculous when describing this to people. I cannot describe, and I might tear up, how different life is without, like I said, I did not realize how much I thought about killing myself and how much that impacted everything. And I don't anymore. So, I mean, you could ask my husband. The difference in my life is just unbelievable.